Welcome back to the Morning Show here on the Rise News. I am Adesiwa Omoruwan.
I'm Rufai Osini.
And I'm Sheito Atigari. Good morning.
Now, in Nigeria, 70% of drugs are said to be imported. These drugs are usually from India and China, which is alleged to be the world's biggest sources of counterfeit medicines.
However, since the Nigerian government launched the National Drug Distribution Guidelines to restructure the drug distribution system in Nigeria, there has been a significant improvement in checking counterfeit drugs. But it is one thing to create a system and another to sustain the effectiveness of that system.
I mean, the sad realities in the drug market really startled all of us. However, because of the open drug market, which will create opportunities for counterfeits to enter the legitimate supply chain, it is quite difficult preventing and detecting counterfeit medicines in Nigeria. So joining us now to discuss this is Chibuzo Opara, the co-founder and co-CEO of DrugStoc, a cloud-based pharmaceutical IT and logistics platform which provides access to verified quality pharmaceutical and health products for healthcare facilities and pharmacies. Chibuzo, let's just go straight to it. A very good morning to you.
Good morning.
This is a big problem, and it looks as though, the good work of NAFDAC can't really solve or settle all of this. I mean, by the time Dora Akinyolu got into NAFDAC, she said that there were some brands of painkillers that was just chalk there out of Onitsha. She got into NAFDAC because one of her family members was killed by fake drug. And let's talk about this, Scotch.
Yeah, I mean, the menace of fake drugs in Nigeria is quite sad. And as you can, when you deal with pharmaceutical products, anywhere between 10 to 30% of pharmaceuticals are usually faked, depending on where you source them from. And that's why companies like ours, DrugStoc, we use our distribution platform to ensure that counterfeit drugs don't get into the supply chain. It's usually a prevalent issue due to poor purchasing power. It surprised you to know that the fake drug market all over the world is bigger than the heroin and the cocaine market. It's shocking, but it's an insidious problem which has continued to plague our healthcare system, primarily because the supply chain is fragmented. So what you have is typically a lot of middlemen come between the pharmaceutical manufacturers and hospitals and pharmacies. And when you have, NAFDAC has done quite a bit. PCN, NAFDAC, the government, they've all done a bit. But then the challenge is always the fact that it's a huge problem that, sometimes proves even bigger than them. Which is why, all hands need to be on deck, and companies like DrugStoc, that deal with supply chain wholesomeness and working on systems,
Yeah, but before we talk further on what you do as a company, and just to put it in proper perspective, a report from the WHO in 2017 said, an estimated 1 in 10 medical products circulating in middle and low-income countries are substandard or falsified. That is huge. And when you wonder where the most of these end up, I begin to think about the literacy level of the people, their awareness. From what you've seen so far, is the average Nigerian aware of this problem?
So I'd say that most people are aware, but then the problem is, what are you going to do about it? Because the issue with healthcare as a system is healthcare is one of those sectors that there's an asymmetry of information between the consumers and the providers, the operators. So typically what happens is most consumers are sort of at, they're not at the best, they're not in the best position to be able to determine. I mean, certain things that doesn't stop you as a consumer from taking, action. You should always ask. You should always, if you know that we have such a high prevalence, you should always ask your pharmacist. Always ask, where do you get your drugs from? Put them on the spot as much as you can.
Are we supposed to be asking that?
Well, even in the rural areas, if you go to the local pharmacy and you see someone in a white overall standing behind that counter.
You call him a chemist.
You think he's a professional.
Yes.
So you don't expect such a person to sell you falsified drugs.
And you know, that's why I asked. Are we supposed to be asking that? Is that supposed to be the role of Pharmaceutical Society of Nigeria?
Yes, that is.
Are we supposed to be asking that? Are we supposed to be safeguarding ourselves? Are we even supposed to even have access to the pharmacy except it's based on prescription?
That's a very good question. You see, there's something called path dependency and antecedents of how the sector developed. Our sector was developed from a very interesting way. If you look at Idumoto Market, for instance, it was the first place where drugs were sold to, for lack of a better word, Nigerians, while the colonial powers were the ones who patronized pharmacies. So when independence came, they were not going to shut down the patent medicine stores and the places where people could consume products from. And to be honest, 70% of Nigerians consume care in those places where we don't have enough professional pharmacists and people there. And it's a sad thing, but what are you going to do? I mean, you can't withdraw care from that sector. We would love pharmacists and doctors to go to the rural areas to man those stores, but the point is, you have 200 million Nigerians, you have 17,000 pharmacists. What are you going to do?
Let's talk about substandard medication issues, because it's one thing to have, fake drugs penetrating the system. However, there are certain drugs that need to be stored in a certain way, kept for a certain time, made sure it doesn't go past an expiry date. Now, you said that you have these drugs in-house and you supply to major distributors. How do you make sure that after they leave your space, they're not, what did I use now? Compromised somewhat. What's the education being done? Because some of these pharmacists, even though, like Adesiwa said, they're supposed to be trust once you see that person wearing the white overall, some of them are still quite below the bar of the education that they need to give out some of these drugs.
So thank you very much, Shaitan. So first and foremost, at DrugStoc, one of the things we do, we operate a cloud-based pharmaceutical distribution system. So all our drugs are tagged and traced. So once they come into a system, they are continuously monitored until the point of consumption. That's the first thing. So within our system, it's bulletproof, and the batch numbers, the expiry dates, all of that is properly tracked. We can recall whenever we want. We know where it went. We're able to determine how, when, where the drug was sold or consumed or whatever. Now, with regards to educating people, there's a lot of that going on. We do a lot of that. We support pharmacies to improve their knowledge and all that. I do have to say that a lot of the pharmacists that we work with are quite professional. And yes, not everybody that wears a white lab coat is a pharmacist. That's the thing.
Or a chemist, like they say.
Or a chemist.
I don't know why they say
but to be honest, even though the average consumer is not supposed to be put on the spot to ask questions, when you go to a hospital or pharmacy, please look on the wall. It always has the license, and do ask those questions, because until we start asking questions as a society, oftentimes a lot of unscrupulous middlemen will slip in the cracks. It's difficult. It's not what we're supposed to do, but this is an emergency situation that we need to.
You talked about the drugs in your possession, and I wonder if you can track, trace, and authenticate drugs at production level, because even with substandard goods and falsified goods, sometimes we see that some of the components that make it to the legitimate production is what causes the harm. So are you also able to trace, track, and authenticate at the level of production?
So it's a very good question. So a lot of the counterfeiting is actually done in the middle part of the supply chain. Thankfully, production is very regulated in Nigeria. You can even tell from the way the government was able to pull the issues related to codeine and all that. They just went straight for the manufacturers. If it was something in the middle of the supply chain, it would have been a bit more difficult. So from that perspective, there's a lot of work that has been done to close that sector. However, the problem is usually at the last mile. Things that move very fast, which are very cheap, are often the ones that are hugely counterfeited. Things that would typically be targeted at your upper to...
Like with every other product, the fast-moving products are the victims to be counterfeited.
Yes, unfortunately.
So let's talk about advocacy by the Pharmaceutical Society and companies like you as regards only dispensing drugs with prescription. I mean, that's a very big issue. We have a funny society where I can walk into a pharmacy and I can get statins and all sorts of medication. I mean, I could get knockoff sleep tablets that are highly prescription medicine. I could get high-level narcotics in the pharmacy. And this is debilitating. This is even ruining your work.
Of course.
What advocacy? I know there was a time the Pharmaceutical Society of Nigeria did say that don't sell, in fact, the law is still on ground, don't sell drugs without prescription. But everybody
Flaunting it.
flaunts it. Everybody.
You are absolutely right, Rufai. In fact, there's definitely a lot of regulation and a lot of advocacy around the fact that hospitals and pharmacies should only dispense drugs on prescription, more pharmacies. In fact, the chemists are not supposed to sell drugs that need prescriptions. Unfortunately, like I said, the supply chain in the middle is quite fragmented. And so what you have is a situation where it's a bit difficult to monitor that from a business point of view for the entire process. You know, when you look at the entire ecosystem, which is why companies like ours, with our system, we're sort of locking in the ecosystem. So everyone who is in our supply chain, everybody who deals with us is locked in. So if you come to deal with us, you're not going to be able to get a controlled drug as a hospital or a pharmacy without submitting, you know, your prescriptions and your request and, you know, having a pharmacist back all that. So it's quite a significant challenge. We would love to have the situation where the entire healthcare system, the supply chain for pharmaceuticals, is entirely closed, where you can't get a drug except you have the prescription of a medical doctor, and you can't have a drug dispensed except it's by a pharmacist.
Is it possible to use blockchain to bridge the gap?
Yes.
You know, because you run a cloud computing platform, and I was just going to remember was blockchain, the power of blockchain. How about we have like a national, you know, blockchain array that every drug that comes into this country and dispensed has a blockchain track record? I mean, talk me through that technological path.
So you read my mind. So we actually have our systems entirely locked in, and we provide those services. The thing is, to create a system where...
I hate to interrupt your line of thought, but we'll have to go to London, where we're expecting President Donald Trump to disembark at that venue ahead of the NATO meeting.
Oh yeah, the Marine helicopter, and the President of America, President Donald Trump, will be coming down. I mean, the meeting has been in top gear. There was a meeting yesterday at the Chancellor's place in Britain. That's number 10 Downing Street. I mean, amongst world leaders. We all saw the parley and the session between Trump and world leaders yesterday. In fact, what was really indicative for me was Emmanuel Macron.
Yes, that was very interesting to see. With President Donald Trump comes a lot of flip-flops.
Oh,
and we
yeah.
saw that yesterday again.
Oh,
He's
yeah.
been the biggest critic of NATO. But
Yeah.
yesterday we saw him take a different stand,
Oh yeah, but
praising NATO.
But Macron gave it to him big time. I don't know, Macron is in cloud nine now. I don't know what's wrong with Macron, but Macron is in cloud nine. Macron gave it to him straight, and he went back to those words that I think NATO is brain dead.
Of course, Arise News will be on top of that summit and bring you updates as they unfold in our subsequent bulletins. But let's come back to our conversation. Thank you so much for staying with us. Rufai asked you a question about blockchain technology.
Yes. So, Rufai, thank you for that question. I'd say you've read my mind. I don't know if you're still in our planning meetings. The key, see, you are right. As a country that is infrastructure challenged, like Nigeria, we can't rely on the traditional way of doing things. We need to leapfrog a lot of these broken systems, a lot of these broken infrastructure issues, and create systems that work for us. And blockchain technology, where every drug that gets into the country is ultimately tracked and traced, is the holy grail. Getting it done would involve, a lot of stakeholders and would involve a lot of significant milestones to cross. But should it be done? Yes, absolutely. Can it be done? Yes. How easy is it? Extremely difficult.
Well, high disease burden, incapacitated local manufacturing, and weak punitive measures for perpetrators are said to be some of the factors fueling this. But thankfully, technology is coming to weed out the fakes. But I'm wondering, I'm curious, because your company deals with the professionals.
Yes.
You don't deal directly with the consumers, do you?
No.
Okay, so I'm wondering who pays for these services that you're offering? Are the pharmaceuticals paying for this, or they in turn push it over to the patients?
Very good question, Adeso. One of the burdens that Nigeria has to bear is the low purchasing power of the population. As such, a lot of things which should be prioritized might not necessarily see the light of day. Healthcare continues to be one of those things that is pushed to the back compared to things which are very prioritized for the government, things like military spending, things like, infrastructure, roads and, waterways, power, because the conversation is always, if you fix power, we're going to have a 10% jump in GDP and healthcare will definitely follow. So those are the typical arguments. However, the truth of the matter is you cannot leave healthcare because by the time you fix all your infrastructure, there will be nobody left to work that infrastructure. So yes, there is a pressing need to create a system, a demand-side financing system that encompasses all the people in the country. Health insurance has been around. It's one of the ways healthcare can be paid. People have talked about healthcare bonds. People have talked about public-private partnership investment into healthcare. The truth of the matter is that when you look at healthcare, it's for a country where 70% of the population is below 35. When you bring up healthcare to anybody, it's not my portion. That's the typical response. So that is one of the signals that the government is, you can imagine a government who is juggling several things that are burning, and then when you talk about healthcare, it's like, it's not my portion. The government is like, okay, maybe I can delay this a bit. But the truth of the matter is that, we can't afford to. We need a healthy population. We need that population of ours to be educated. We need our young ones who are below 5 to eat well, to have the proper medication and nutrients and vitamins such that they have enough strong cognitive power so that in 25 years when we're 400 million people, we don't now start worrying about the fact that 50% of the population is ill or sickly.
What do you think about the punishment that is allocated to some of these drug traffickers and counterfeiters? I'm of the opinion that it's not deterrent enough. You're looking at about 500,000 naira if you're caught, or 2 years imprisonment. I mean, 500K is probably an amount of money they make in a day. They are easily able to pay it. Do you think that maybe this should be looked into? And what would your suggestions be?
So first and foremost, for sure, the 500,000 naira is nowhere near enough punitive deterrent. Primarily because, like I said, all over the world, the fake drug market is actually bigger than the cocaine and heroin market. People don't really understand how big the market is. So I definitely think that you should have more severe punishment. However, no matter what the punishment is, the punishment for smuggling drugs is quite high, and people still do it. So no matter how high the punitive deterrent is, you're still going to have people that will, try to mess around. So I think, on the one side, you need the punitive thing, but on the other side, you need to create those systems, like plug all those leaks where it can happen. You need to make it more efficient, more effective for the drugs to get to the consumer. You need to create systems where people are not, trying to circumvent, the proper process, either because they can't afford the drugs, either because they feel that, because the thing is, if a drug is 1,000 naira and somebody comes and says, oh, same drug, 500 naira, a lot of people might just jump because they can't tell the difference. But you should be able to have a system where at the level of whoever is given the drug, he can say no.
And it's so ironical because in India and China, where these drugs are counterfeited and falsified, they get death penalty.
And that's the stark reality. That's why I even want to bring the conversation to the health insurance companies. Because especially when we have a national health insurance in this country, one of the functions of the health insurance company is to also procure drugs. I mean, that's the NHS does drug deals with the top pharmaceuticals all over the world to be able to get drugs for the health insurance in England. I mean, when are we going to have, or are you having conversations with our national health insurance and various HMOs as regards the conversation on drugs? Because that's part of the statutory function, getting the best drugs at a cheaper rate for the people through the hospitals.
So you're absolutely right. So when it comes to health insurance, we operate a slightly different system from the NHS. I think that's, and health insurance sort of an arm's length relationship with pharmaceuticals. Should it be like that or not? That's up for debate, but that's kind of what it is now. So you don't have a system where you're able to, you have a system where pharmaceutical health insurance companies set caps. And so they use market tools to regulate. Should they step in? That's also up for debate. Should the NHIS be doing more? Definitely, I think. Should they step? But you also don't want to have a regulatory overreach in terms of trying to get into pharmaceutical supply chain.
Okay, very quickly, because you have just about a minute to answer this. Since you've been in the business since 2015, 2016, what have you noticed? Do you have data for these falsified drugs in Nigeria? And what are you doing with this data? Are you talking with NAFDAC? Are you publishing it for the public to know what is going on?
So we do have data of products that come through our platform. We do some market research from time to time on the prevalence of fake drugs and all that. We're open to share the data. We've never been approached by NAFDAC. We've, at some forums, shared certain information we have. However, we do share information with our pharmaceutical partners in terms of the products. At DrugStoc, we consider ourselves a quality first, empowering healthcare providers, and ensuring that patients get the drugs cost effectively. And we try to ensure that, we're so into our quality that we don't even, with our recent ISO certification, we ensure that.
Okay. I would like to say a very big thank you so much for being here.